Hi, my name is Dr. Edward Dourron, Medical Director at Pathways Fertility in Atlanta, Georgia. And I want to talk a little bit about hysteroscopy. So I've been performing office hysteroscopy since 1999 on fertility patients. And I wanted to basically describe the difference between office hysteroscopy and traditional hysteroscopy done in a surgery setting, like in a surgery center or a hospital. So for my patients that have an office hysteroscopy, they don't have to fast. They can eat a normal breakfast. Let's say if their appointment's at 10 a.m., they would arrive here usually about 15 minutes before the appointment, get prepared. The entire procedure lasts about 5 minutes. There's no anesthesia required. I do recommend that patients take Motrin an hour before the procedure. Because the procedure is so brief, very little discomfort, and patients are able to get up and leave immediately after the procedure, return to their normal activity and go back to work or whatever activity they were doing. So that's office hysteroscopy, and it allows me to do removal of small fibroids, polyps, scar tissue, essentially anything that can be done in the operating room can be done in the office on a smaller scale. Contrast that with, and so that procedure, it's important to understand, in our office is $1,500. So that includes all the equipment and the procedure in the office. If you do it at a surgery center or at a hospital, typically you'll be asked to not eat or drink anything after midnight, so you'll have to go in fasting. You'll typically arrive at the surgery center an hour and a half to 2 hours before your procedure. You'll have an IV placed, you'll have IV anesthesia given, and you will be knocked out for the procedure. They will do essentially the same hysteroscopy while you're asleep. And then at the end of the procedure, you're in recovery for at least an hour. And then you have to be driven home because you're recovering from anesthesia. And basically, the rest of your day is going to be spent at home recovering from anesthesia. So that procedure typically is going to be about $5,000 to $6,000. And you can see how much time is involved with that compared to the simple in-office procedure, which requires no anesthesia and no fasting, and very convenient for the patient, and a very much more cost savings for the patient compared to the in-surgery center hysteroscopy.